Good afternoon, everybody. Thank you so much for tuning in on another Speaking of Miracles, Lunch and Learn with our Children's Miracle Network team. My name is Tara Tovkach, Development Associate on the Children's Miracle Network team here at UF Health Shands Children's Hospital. And I'm so excited to be here today with Dr. Laura Jacobsen from Pediatric Endocrinology at UF Health Shands Children's Hospital. She is also an Associate Fellowship Director and an Assistant Professor in the College of Medicine. Thank you for joining us. Before we dive in, we're going to hear from our speaker. I wanted to share a little bit more about Children's Miracle Network hospitals and the impact that we have here on our hospital in Gainesville, thanks to the incredible partnerships, programs, and events that fundraise all year round for us. UF Health Shands Children's Hospital is our local member network hospital of Children's Miracle Network hospitals. CMN Hospitals is an international nonprofit organization dedicated to raising funds and awareness for children's hospitals. CMN's founding pledge is to keep all donations in the area in which they were raised, and it remains at the core of their philosophy. On the call today, we have a great gathering of partners, such as our friends from Dance Marathon at UF and FSU, our high school dance marathon programs, folks from Dairy Queen, Extra Life, Campus USA, Ace Hardware, Southwest Georgia Oil, McLean, Knight Transportation and Swift Transportation, Wawa, Remax, and so many more supporters of Children's Miracle Network. Throughout their partnership with CMN hospitals at our hospital, they have the ability to serve the children coming to our hospital for medical care. With all funds going back to UF Health Shands, we are able to make an incredible impact on the lives of children and families who need advanced medical treatment. Every dollar we raise is ensuring our hospital is well equipped with the proper tools whenever children need them most. Your fundraising has helped purchase life-saving equipment, fund groundbreaking research, and provide funds for diversionary and social support programs that would not otherwise be possible. As we hear from our speaker, Dr. Laura Jacobsen will be sharing some more details about how they see CMN funds in everyday action at our hospital, whether that's through her research or programs that support our patients. Real quickly, if you are tuning in on YouTube on the live stream, you'll have to be logged in to do so, but feel free to put questions in the chat as we'll be monitoring them, and we'll have time to answer them at the end. We also have the ability to take questions via text too, so you can text chat live to 41372 to ask questions throughout. So with all of that, let's begin and hear from our fabulous guest, Dr. Jacobsen.
All right. Thank you so much, Tara. I appreciate it. I'm really excited to be here and talk about the work I've done and been very fortunate to be supported by Children's Miracle Network and other sources, both inside and outside of the University of Florida. I'm a pediatric endocrinologist, so I care for kids with diabetes and endocrine disorders. I went into medicine because my mom was a nurse anesthetist. And I went into endocrinology because when I was a college student, which I know a lot of you guys are, I first volunteered at the Florida Diabetes Camp and learned about type 1 diabetes and was really just moved by how awesome these kids are and the day-to-day work that they have to go through to manage their disease and still have the time of their lives at camp. So that's about me.
Awesome. Thank you so much. So what drew you towards pediatric medicine? You mentioned the Florida Diabetes Camp. What in particular, do you have a memory or something that made you feel like this is it? Like, I want to go into pediatric medicine?
Yeah, I honestly wasn't really sure what field of medicine I wanted to go into initially, but I've worked in a daycare and other places with kids growing up, and so it's always a more fun job when you get to work with kids, and the fact that part of my volunteering over the summer was to be a camp counselor for kids with medical conditions. It's incredibly rewarding to learn with them how to give insulin injections and check their blood sugar. Wow. And I felt like I got just as much out of it as they did. And to be able to do that every year for the rest of my career, that's why I chose to go into this.
Awesome. So for folks that don't know, Dr. Jacobsen also does a lot of research for our hospital. So in simple terms, because I like to kid with my students, I am not anything in the health sciences realm. I was a business major. Could you share some more about your research that you participate in and how the breakthroughs in your research will ultimately change medicine?
Yeah, so I know as I said, I care for kids with a lot of different endocrine conditions, but my research does focus on type 1 diabetes, mainly trying to understand what leads to type 1 diabetes, kind of what the pathway towards developing type 1 is, and also trying to get new interventions and therapies available. Right now, we only have insulin to treat type 1 diabetes, but it's actually an autoimmune disease where the immune system has gotten confused and it's attacking the pancreas that makes insulin. So, us and others are trying to test different immune therapies to try and actually change the disease course. So, we do a lot of immune therapy clinical
Mhm.
trials for type 1 diabetes and try and understand who would benefit most from those.
Gotcha. Um, because through your research, I guess it will be, I feel like you might have a good answer for this one. What is special and unique about working at an academic medical center in terms of how you get to research and the treatment that you care for our patients to?
Yeah, there's a lot that goes into that. So, working at an academic medical center, you get to have so many different opinions and support and so many different fields that could contribute. So, I'm in pediatrics, but I work really closely with pathology and immunology. Our awesome endocrine team that focuses on metabolic disorders and obesity, they work with the physiology department. So we wouldn't be able to do those kind of collaborations if we weren't in a center like this that really values research. Because if you're in a purely clinical setting, you don't have the protected time to be able to do that. If we're doing clinical care, which is what we're incredibly passionate about, if we were doing that 24/7, we wouldn't have time to do these research studies and clinical trials. So it's been really great to collaborate across disciplines.
Wow. And I know you did your residency here, right? Or your med school?
I did undergrad, med school, and fellowship here. Residency
Oh,
was the only
wow.
thing I did not do here.
So you got away from Gainesville and then came back to Gainesville. What drew you back to our hospital in particular?
Yeah, so when I was a medical student, we rotate, through all different areas of the hospital, and I was just really blown away by the pediatric endocrine department here. So Dr. Schatz, Dr. Haller, Dr. Bernier, they're all just incredible mentors. And so I knew that when I was going to do pediatric endocrinology, that I would want to come back here and train. And
Wow,
then I decided to stay 6 years later.
that's awesome. Well, we're happy to have you. What is the most rewarding part of your job?
So everyone probably has a slightly different answer, but caring for patients is the most rewarding. It's why we do the research. It's why we went to medical school. So just being able to laugh and play with my patients as they grow over the years, pediatric endocrinology is great for that. It's very continuous. We get to see kids for years and years, show them, how to manage their own medical conditions and do all the things that they can do. So that's the thing that really gets me out of bed in the morning. But I also get to do that in a research setting with clinical trials. So where I only may have 20 to 30 minutes with a patient during a clinic visit, I could have 2 to 3 hours with a patient during a clinical trial
Wow.
because they're getting an infusion or they're coming for frequent lab monitoring. And we can really talk um, a lot about their disease, how they're handling it, and what they need to be able to live successfully with type 1 diabetes.
Wow. Do you mind sharing a little bit more about what kind of clinical trials are advancing the treatment of type 1 diabetes or diabetes in general?
Yeah, so we do a ton of clinical trials in people who are newly diagnosed with type 1 diabetes. So either investigational therapies that we've done here at UF or that different companies or other universities have developed. And we help recruit patients and see how those therapies are working to preserve those patients' individual insulin producing cells. So we can see, like, are they making their own insulin for longer?
Mm.
We also do some trials in people who are at risk for type 1 diabetes. So they're potentially going to get type 1 diabetes someday. And there are therapies we're trying to kind of push that off or delay the onset. And so we and other academic centers throughout the country are part of a network called TrialNet, which does type 1 diabetes clinical trials on kind of a global scale.
Hmm.
And as part of that, we were able to be one of the sites that testing a therapy called teplizumab, which is now the first FDA-approved immune therapy in type 1 diabetes to delay the onset. So there's no other immune therapy to delay the onset of an autoimmune disease before.
Yeah.
It's really exciting.
Wow. What indicates, and this is me just being curious, of what indicates someone might be more prone to being diagnosed with diabetes later on?
Yeah, so specifically for type 1 diabetes, because it's an autoimmune disease, we can actually find markers in the blood called autoantibodies.
Oh,
So
wow.
if the pancreas has been irritated or attacked by the immune system, it lets off little proteins, and the immune system recognizes that and makes antibodies against it. So if these antibodies are floating in the blood, we can measure them. And so there are several antibodies specific to type 1 diabetes. That if you have a certain number of those, that you have a high lifetime risk of developing type 1 diabetes.
Interesting. I know part of kind of getting into the philanthropic giving in your department and how being a nonprofit children's hospital that we rely on that community support, like our friends from all these partners and our dance marathon programs and Extra Life and everybody supporting Children's Miracle Network. It relies on that support to be able to give care and advance the research that you guys are doing. Can you share a little bit more how those charitable dollars are used in your department?
Yeah, so several different ways. What we in the Division of Pediatric Endocrinology do is we use Children's Miracle Network dollars not only for our individual research. So as a fellow, I was funded for individual research projects on CMN dollars, but we also use them clinically to fill holes that the institution is not able to provide at that time. So in our division, we have a lot of different support staff that we need and other pediatric clinics need, medical assistants that are familiar with the types of medications that we prescribe, social workers. We're actually very desperately in need of social work support right now. And even from a research standpoint, we enroll patients in clinical trials, but not every person has access to clinical trials. Like not everyone has
Right.
access to the same clinical care because they may not have the monetary resources or safe housing or appropriate food. So we are so heavily dependent on our social work team to help us help those families. So dollars have gone to help support those roles. Even part-time psychology support within our clinics have been supported on CMN dollars.
That's awesome. Thank you for sharing that. I know you have slides too. Do you want to pull those up?
Yeah, I was trying to think when would be a good time, but yeah, let's go ahead and do that.
Let me grab these away real quick and we'll put these up. All right.
And we can probably just go to the next slide. This is
Yeah.
just us showing that, we're one of the top pediatric endocrine divisions in the country, according to the US News and World Report metrics that come out every year. So we're very proud of that.
Very proud of that ranking. So a moment for that. But I'm hoping everybody is applauding from where they're watching right now.
I wanted to share a picture of our team because I know I talk about my research, but there's actually a lot of research done within pediatric endocrinology and a lot of clinical programs as well, that all have to start somewhere. We can't just create these out of nothing. So they really go into applications really well for CMN because they're looking for unique ways to achieve the highest quality patient care. So this is our entire division from a couple years ago at a retreat. And I like to show this because it's not only all of our providers, nurse practitioners, but it's also our support staff. So we have medical assistants, we have certified diabetes care and education specialists who do our education for our families. We have nurses, and then we have quality improvement that goes on. So we have a coordinator that helps with that. And we have a lot of other research coordinators that help us get these clinical trials done. And we couldn't do that without all of these people here. And I mentioned Dr. Bernier's Fun and Fit booth. So she has developed a program basically about exercise testing in our metabolic clinic, and having volunteers come and help talk about healthy drinks and healthy eating habits, in addition to doing exercise testing, which is really great to incorporate in our clinical setting. So
A little self-promotion, the Fun and Fit program was also supported by Ace Hardware dollars. A few years ago, we received a fantastic grant from the Ace Hardware Foundation to support the funding of that program. So another way that Children's Miracle Network is kind of at work on the side within your department. That's really cool.
Oh yeah, so several different ways. Yes. And if you go to the next slide, I think I just have pictures of kind of some of the activities we've done as a division. Most of these are my photos, so I'm unfortunately in most of them. But if you look at the upper left, that's one of our doctors, Dr. Dayton, showing off a poster at our Clinical and Translational Science Institute, talking about her work in fatty liver disease. The next picture to the right is me when I was a medical student at diabetes camp. Awesome. So very excited to still have that photo. And then other photos you'll see, the one next to it is actually when I was coming back as a camp doctor for our 7 to 9-year-old camp for kids with diabetes. And then there's a picture of a lot of our staff and volunteers at diabetes camp, and they all have diabetes related tattoos. And that picture was actually on the cover of Diabetes Care,
wow.
a very prominent medical journal for type 1 diabetes. On the bottom row, myself and Dr. Miller are running for one of her research programs. So Dr. Miller studies Prader-Willi syndrome, which is a genetic disorder that makes it so that you don't feel full. And so you tend to overeat, and it causes a lot of medical complications. But she's raised so much money because of the supportive patient population that she has to try and find medications to interdict in that process. And also really good dietary counseling to help kind of keep it under control. And these kids are having very, very good outcomes.
Wow.
And the second 2 pictures over on the right is Dr. Miller and her dietitian, Mike Tan, dressed up as bacon and eggs for Halloween. So just a lot of fun that we have. And I think most people would say, you know, we all really love working together and then working for our patients in the community. I think the last picture is just a little bit about diabetes, just because I like to share about type 1 diabetes. So, you know, on the upper left is kind of just a caricature of the pancreas, and inside the pancreas are these little islands that have the cells that make insulin. So you can see all the little pink cells or cells making insulin. And at the same time, the pancreas also makes a hormone called glucagon. And through programs we have here at the University of Florida, specifically the Network for Pancreatic Organ Donors with Diabetes program, we've actually been able to look at the pancreases of people with type 1 diabetes.
Wow.
And you can see, if you look at the bottom of this picture, this is a pancreas slice, that there are a lot of these islands that still have that insulin in them. But if you look at the upper right corner, all of those islands have lost their insulin already. So this is someone very early in the course of type 1 diabetes. And so we've learned a lot about what is causing type 1 diabetes, and hopefully some ways that we can keep interdicting and trying to disrupt the autoimmune process. So we've learned a lot from a lot of different avenues for type 1 diabetes research.
A little bit more about diabetes, because I'm learning so much, first of all, so thank you. For many years, I know most people called type 1 diabetes the juvenile diabetes, but we know it's just not a young childhood disease. Can you share a little bit more about the average age range that people are being diagnosed today, or how that's kind of changed? That's how I always grew up hearing it, honestly.
Yeah, for a long time, we thought type 1 diabetes, or the autoimmune form of diabetes, was something you got as a kid, and type 2 diabetes would more the insulin-resistant diabetes you got as an adult. But really, neither of those things hold anymore. Type 1 diabetes can occur at any age. Often we think of the peaks in early childhood and adolescence, but more than half of the people newly diagnosed with type 1 diabetes nowadays are over the age of 30. So we actually have probably more adults being diagnosed. And the hard thing is that as an adult with newly diagnosed diabetes, it can be confusing whether that person has type 1 diabetes or type 2, and it may lead to a delay in diagnosis if we're not aware of this fact. So I'm so excited that you asked me to share that type 1 diabetes can occur at any age, and that's why we don't call it juvenile diabetes anymore.
Wow, I did not know that. That is, and I'm sure at that point you're also in such a routine too with your life, and trying to break that to be taking care of your diagnosis is probably very difficult. Wow, that's really good to know. Thank you. I know our hospital has seen seen the number of our patients seeking care from our diabetes and endocrinology teams increase. Are you seeing any trends that are driving these patients to UF Health in particular?
I think a lot of patients come here, specifically for pediatric endocrine and diabetes care, because we have people interested in the research aspects. For type 1 diabetes, we have a lot of knowledge of these trials that are going on that patients can elect to be a part of, and are just really engaged in keeping up with the literature and the evidence for all of the endocrine conditions that we care for. And really working with our families to make our clinics the best we can. So I like to think that's why people come here.
That's awesome. I've got one more question, and then everybody, reminder, you are welcome to text us any questions or to comment them if you're watching on the YouTube side of this. Since we have supporters on the call with us, so many, like we went through the big list. If you have an unlimited amount of philanthropic support, who could you and your team, or what could you and your team do to move medicine forward? What's the big dream for your team if you had unlimited dollars?
Oh my gosh, you don't want to ask us that. No, I'm just no. If we had unlimited dollars, we would love to have a building where all of our services were all together. Our endocrine clinics, our diabetes clinics, our research team, our all of our support staff, psychology, everyone who's involved in the care of these kids. We would like that all to be in one place. We're all at the University of Florida and we're all in the College of Medicine, but we are scattered in multiple different buildings.
Right.
We would love to all be in one spot so we can have really cohesive clinical to research care. Taking a step back or trying to make that a smaller ask would be we desperately need funds for a social worker, and then psychology full-time. Those are the most important clinical needs that we as doctors and nurse practitioners and even nurses and educators just cannot fill that role, and really need that is such a big part of our care for our patients and their families.
While we see if any questions will trickle in, is there anything else you'd like to share with our viewers as they're actively fundraising? And like I shared at the beginning of our call, that some folks might be watching this live with us, some might come back and watch this later for some inspiration to keep fundraising. A lot of our associates that are helping us at the corporate partner level, at our Walmart, Sam's Clubs, Ace Hardwares, they're asking with every transaction if you want to give to Children's Miracle Network. What would you say to those folks just to encourage them to keep going and why this is so important?
Yeah, and you can take down the slides if you want. I think if anyone has ever worked with kids, all kids want to do is be kids. And so our goal is to help them do that while keeping them safe and healthy, right? So that's what Diabetes Camp is for. That's what Boggy Creek is for. Like, come and do all the normal kid things, and still being safe and healthy. And that really helps families as well, give them peace of mind that, oh, my kid can do anything. My kid, can learn what they need to manage any disease that they're happen to receive a diagnosis of. So what I would say is we're always here to improve what we do, and we can't do that without outside support. So if you just want to picture a 6-year-old or a 7-year-old at Diabetes Camp learning how to give their first insulin injection all by themselves, like that's what, why we're all here, and to be able to provide the research and the support to keep all of those things happening. Like that's what I think of every day.
Wow. Well, it doesn't look like we're getting any other questions trickling in. It was probably because I had so many off the top of my head questions about diabetes to learn about today. So I hope everyone learned just as much as I did, but I don't think we could have ended this session more perfect with imagining the kids that we're impacting, and the simple line that kids should just be kids, and whatever we can do to help that, to help them figure out a lifestyle that is new for them if they're being diagnosed with diabetes. I think we couldn't have ended it better. So thank you so much, everyone, for tuning in today. Thank you, Dr. Jacobsen, for your time. We super appreciate it. And if you have any other questions, feel free to put them in the comments if you're watching it back, and we'll be sure to get some answers to y'all. But thank you so much for everybody's time today, and we're going to hop off.